Thank you, Toy. Well, this month is National Breastfeeding Month. Not every mom can breastfeed, but we know there are benefits to breastfeeding our newborns. Glenda Dickerson is the Women's Services Manager and registered nurse at Brookwood Baptist Medical Center. She joins us this morning to talk more about this. Good morning, Glenda. How are you?
I am fine, thank you, but I'm going to correct my title. I'm the retired Women's Support Services Manager.
Okay,
I
well,
do still work with them, but I am retired, so
well, good for you
I'm
that
at
you're
home.
retired. But
Yeah.
you still work with them. But you know your stuff is the point of what we're saying here. And so when we talk about breastfeeding, and I do want to address this up front first, as I mentioned in the lead, not every mom can, and sometimes women feel bad if they're not successful at it. Would you agree with that?
Oh, absolutely. And that's something that we try to deal with very gently with them because mothers want to be good mothers. And sometimes mothers don't breastfeed because they're fearful of it or they've not had family experiences with it. And then sometimes they're fearful that their baby's not getting enough. And I tell people in class all the time, because I still teach education classes to the staff, what I call a mother who wants to supplement her baby is a good mother because she loves her baby. Our job is to help her not supplement and not get started with formula if we possibly can, because, that's the best thing for the baby. But moms love their babies and they want to do the best for them.
Well, they certainly do. And the main benefits of breastfeeding, I know we've learned more over the years, but run down that list of why you say it's so important.
Well, some of the common ones that I think most people know about is a decrease in just the everyday infections that children get, ear infections, diarrhea, respiratory infections. I'm healthier because during the time that she's breastfeeding, her immune system is boosted also. That's the way our species survives, is by the mom being healthy enough to care for the baby. And then there is the longer term benefits, the autoimmune diseases that are decreased, cancer, diabetes, asthma, all of those things are decreased in babies who are breastfed. And then in mom, the same thing. When you've got a mom who is breastfeeding, she is less likely to develop cancer. And one surprising finding is she's also less likely to have osteoporosis. She's less likely to have rheumatoid arthritis. So some of the autoimmune diseases are decreased in mom also.
So as we get ready to wrap up here, how long do you recommend now for moms to breastfeed their babies?
That is a great question, and moms ask me that all the time. And what I say is, my opinion doesn't matter. The American Academy of Pediatrics just updated their statement on breastfeeding and the use of human milk. And what they say is that they recommend exclusive breastfeeding for 6 months with the addition of complementary foods for at least 2 years and as long thereafter as the mom and the baby would like to. So that's a new recommendation from them. It goes along with what the World Health Organization and the Academy of Breastfeeding Medicine have been talking about for a while, because the research is in, and the longer a baby is breastfed, the more the benefits.
And certainly a lot of women watching, I know they're saying, well, I breastfed my child a lot longer than the 6 months. You're just saying that is at least the recommended, right?
The 6 months is for exclusive. The at least is for 2 years with the foods that are added in. So, and that's not culturally common in the United States. So it will take a while for us to accept that as a culture and for moms to buy into that. One of the biggest reasons that mothers stop breastfeeding early is workplace accommodations. That when they go back to work, they don't have places to pump and they don't have an employer that's friendly towards them continuing to do that. And so as a community, when we surround our mothers and we support them, then we'll start seeing those health benefits that are realized to all of us, because decreased healthcare costs impact all of us. And then we'll start seeing moms breastfeed for a longer period of time.
It sure does make you feel more comfortable if it is the norm, rather than you going, I've got to slip away real quick and do this, to get the breast milk. So yeah, times are changing slowly, but they are changing. Glenda, thank you so much.
You're welcome.
All right.